Hi, and welcome back to Body Beautiful. I'm Janelle Marie. We are talking plastic surgery procedures with Dr. Joseph Mealy in his Walnut Creek office. We've talked about so much. Now we're going to talk about another popular procedure, I believe, tummy tucks.
Tummy tucks, very popular.
Why? Who needs them?
Mostly mommies. I do a lot of tummy tucks after childbirth. And we usually like to wait till after childbirth because childbirth tends to stretch out the belly. And if we're going to tighten it, we kind of want it to stay tight.
Kind of want to wait.
Yeah.
Let's go to picture number one because we have a lot of good before and afters for the tummy tuck. So what did you do on picture number one?
So this is a lady who'd lost quite a bit of weight and had really gotten into good shape, but was not happy with the way her clothes fit because she still had this large pannus of skin, that skin that hangs down. And you can see even above that, she's got this area that sort of pokes out.
Yeah.
That's because the muscle's been stretched. She has a diastasis from pregnancy and from weight gain.
So you have to basically get in. What was the procedure on this? Get in there and cut that muscle and tighten it up?
Well, we don't cut it, but there's a tough case around it, and it's covered with what we call fascia. And it's a very tough material that we can imbricate, fold on itself, just like a corset internally.
Wow.
So we tighten that up. That gives us a nice flat foundation.
Looks
and then we draw the skin inferiorly, take off all the extra skin at the bottom. The belly button kind of goes along for the ride. So she keeps her belly button. It just has new neighbors because we pulled the skin down. So we make a new buttonhole for it to come through.
Make a new buttonhole. I like that.
So you can see afterwards her belly looks very flat.
It looks great.
She's super happy with the way her clothes fit.
And as we go to picture number two, I know a lot of women are scared of the scar for a tummy tuck.
Sure.
And obviously it will fade, but you're doing them so thinly now, and aren't you covering them up nicely?
I think it's a process of putting them together with good layers and then keeping that area, treated well afterwards. So we use silicone, topical silicone to help with the scars. In this case, I have had her pull the pants down afterwards just so you can see where that scar is above the belt line. And she has a really nice scar.
Yeah, that doesn't...
But there is a scar. So I mean, you have to be realistic. If we're going to get rid of the skin, there's going to be some evidence of it. The main goal is we put it low enough so even if it's not a great scar, it's hidden most of the time.
Exactly.
But I'd say the vast majority of the time the scars are nice and thin and flat. Once in a while we'll get a scar that's a little raised or thick. Usually it's in the central portion, and we'll go back and revise it if necessary.
And as we go to picture number three, because this looks like a big procedure number three here, what was the downtime on this? And obviously you put them under anesthesia.
Yeah, with these and most of the tummy tucks, I like to keep people overnight. We do it under anesthesia. So the nice thing from the patient's perspective is the medicine goes in and then they're done. So they don't have to worry about any of that part in the middle. In this case, she had a lot of extra skin.
Yeah.
And sometimes in these cases, we'll actually make a vertical scar to take out some of that skin.
Wow.
In this case, we did not. We just used the lower scar. But you can also see it raises the thigh a little bit too.
I noticed that. I was going to say that. A lot of women as they age can get the crepey skin on their thighs. So that helped. Does it take away that crepey skin for the whole thigh?
It does for that upper part of the thigh,
nice.
and if you extend it around like a lower body lift, it helps the lateral thigh too. For that stuff in the middle between the legs, you usually need to do a thigh lift, which has a scar either down the middle of the thigh or up around the top, sort of where the leg meets the pelvis.
It looks beautiful, the after picture. I've got an email here for you, Doctor. Suzanne from Danville wants to know about stretch marks, which you have a little bit in this picture. And also picture number four, as we go to number four, there's some stretch marks there. Does that get rid of all the stretch marks, or can those darn stretch marks be taken away?
Well, stretch marks are part of the skin. So what they are is a tear in the dermis and the deeper part of the skin. So when we do tummy tucks, all those stretch marks at the bottom where we're removing the skin are removed with the skin.
Yeah.
But you can see in this last picture, there's stretch marks well above what I've removed.
Yeah.
But it still looks better because we've tightened the skin and we've made it smoother. And I think it helps.
And in picture number four, do you also have that muscle problem? Is that what I'm seeing with that?
Very common.
Kind of, it is, okay.
Yeah, it's very rare that I will not tighten the muscle during a tummy tuck.
And so when you tighten the muscle, is the downtime a lot longer because can you get up? I mean, is it like, is it pretty bad after going
It's sore.
in?
So the first couple of days, usually it's pretty sore. We may even need help getting up.
Yeah.
But after that, especially when people are already standing, they feel good. So a lot of my patients will just stay up for a while if they're going to get up. It's really that transition from either laying down to standing or sitting to standing that's a little hard. After a few days, it gets better. By the end of the week, most people are good.
All right.
And I would say 2 weeks before doing a lot of vigorous stuff.
2 weeks before getting back out there. All right, before and after pictures, you can see them on the websites, drmealy.com or sanfranciscobreast.com. Remember, if you want to check out any of these procedures, call the doctor's office, 925-943-6353. We will be right back with lots more on Body Beautiful.